Hello again. Today the topic is lung cancer. Cancer Prevention Seminar, Chapter 9. Lung cancer is something that we need to discuss because it is one of the most common cancers around. And the reason for that is what you see in the picture, smoking. Smoking has been decreased in some countries, developed countries like the United States and European countries. Even in my country, in Brazil, they did a very good campaign against smoking. The problem is that still in many developing countries, the prevalence of smoking is still high. And many smoking companies are going into those countries and developing new factories and cultivating tobacco there. And some of these governments, they think that they will have a good incentive when the factories in the smoking industry comes. But when the smoking industry comes, in fact, will give them more employment, give them more income taxes or interest and things like that for their development. So in the short term, they might have a good advantage, maybe in 10 years. But after the 10 years, what is going to happen is that many problems with smoking start happening there. And then from 20 years and older, cancer is going to be a problem. And then this will become a very complicated problem for that country. So it's an illusion for the country to bring tobacco companies or smoking producing companies, because at the end we'll have a very complicated toll in the health of that country. For you to have an idea, in the 20th century, smoking was responsible for 100 million deaths. Just in 100 years, between 900 to 2000. Between 100 years, between this period, 100 million people die because of several problems with smoking, heart disease and cancers and bronchitis and chronic obstructive pulmonary diseases and so forth. The expectancy is that by the end of the 21st century, smoking, if we continue in the rate of smoking that we have, increasing in the developing and the underdeveloped countries and decreasing in the developed countries, is going to be more than 1 billion people that will die because of smoking. You can see that there is no advantage to get smoking to a country, because we'll increase the death rates on that country. Now I would like to go to show a video just to start the presentation today to illustrate the issue of smoking.
Every cigarette is doing you damage. New research shows how tobacco smoke attacks a vital gene which protects lung cells from cancer. One damaged cell is all it takes to start lung cancer growing. Every cigarette is doing you damage.
I would like to introduce the lecture talking about Dr. Ernest Winder. When I was a student in Loma Linda, this doctor came and gave us a seminar about smoking and about his battle against smoking. So it was many years ago. I believe now he's already dead. But Dr. Winder was an old one of the former anti-smokers doctors in this country. And he was studying the relationship between smoking and cancer by the year 1950. He was looking for a population that did not smoke. Someone told him that he could visit the Mormons in Utah or the Adventists in Loma Linda, California. So he was living in New York, and then on that time he took the train and moved westward to find the population that didn't have much smoking, because what he was going to compare is to see if the population that's not smoking compared to a population that smoked, to see if the rates of cancer, at least lung cancer, were decreased in the population that didn't smoke. So he went to Salt Lake City in Utah, and he found when he left the train there was a lot of people smoking, and then he decided, no, I'm not going to go there. He went back to the train and then moved to Loma Linda. When he arrived in Loma Linda, we still have the sanitarium on that time, the first sanitarium in Loma Linda. He went to the Loma Linda market, and then he went to the market and entered in and asked the lady that was in the counter if he could buy a pack of cigarettes. The lady responded, "I'm sorry, sir, you have to take back the train and go to Redlands, because here you are not going to find any cigarette in this place." And then he said, well, this must be the place I'm looking for. He wanted to compare the non-smoking population to a smoking population and check for the lung cancer incidence. He stayed in Loma Linda for a while, and then he went back to New York. And then he left some instructions to Loma Linda doctors to check for lung cancer in the local population. And he went back, and then they could communicate by phone. I believe that time they had already phone, not the cell phone that we have now. After a couple of months, one doctor from Loma Linda called Dr. Winder, and then he said that he found one man that had died of lung cancer, and then he want to report this to Dr. Winder. Dr. Winder asked him more information about the disease, and when they talked, they said, well, he died at 104 years old. And then Winder said, come on, forget about that. I cannot even use this guy as a research subject. Yeah, and that was the main thing about cancer in a population, lung cancer in a population that does not smoke. Could not find many people. But Winder, when he was a resident physician, he used to work with Dr. Evarts Green. Evarts Green was a famous chest surgeon, and he was the first that did a surgery for lung cancer, what we call lobectomy. But he was not convinced about the theory of Winder. Winder was telling him that smoking is related to lung cancer, because he was seeing his patients. Most of the patients that they operated, they were smokers, and so something was there. As I mentioned before, Dr. Graham was the first to develop this technique, the lobectomy, that didn't need to take the whole lung, but just the part of the lung that was affected. He was a very skillful surgeon and doctor, but he was also a heavy smoker. When working with Winder, he allowed Winder to check his patients for research on lung cancer and smoking. And they published the results in 1950. And when Winder figured out that there was a correlation, he stopped smoking. But when he stopped smoking, he talked to Winder and he said, you got good results on your research, but I think it's too late for me. Dr. Graham stopped smoking in 1952 and died 5 years later of lung cancer. I mean, the guy that was a surgeon that developed a procedure to operate lung cancer now was a victim of his own disease, of his own diagnosis, of his own profession. Lung cancer incidence rates in the United States are like that. You'll see that is more prevalent in male than in female, the pink and the blue, and then is more frequent now among black males, and probably because black male will smoke more or smoke more, and is very low in Hispanics, and probably Hispanics smoke less. But let's check on that. What is the difference here? So why Hispanics have lower rates of lung cancer? So you see by racing this slide, who are the ones that smoke the most? So this is very contemporaneous data, but I think Dr. Winder was the one that started making the comparison, and we could use this comparison as well. You see that Asian and Hispanics are the lowest consumption or lowest smokers. And then the black are the highest, and then they have the highest level of lung cancer. Hispanics have lower incidence of lung cancer and chronic obstructive pulmonary disease. And the reason for that is also related to their diet. I like this slide because it represents the intake of beans in their community. So they might smoke less, but then they have some other factors that counteract that. But the main cause of lung cancer is still smoking. I like this trap that they do not for rats, but for human beings. The most common cancer, except for skin cancer in the world, 1.4 billion in 2002. It still is the biggest cause or the most cause of cancer this year, 2017. 75% of men are affected by that, but women are increasing the rates of lung cancer. Why? For two reasons. Women is more susceptible for the chemicals that smoking have, and the second reason is that women are starting, because of the liberation, they start copying some activities that are exclusive for male in the past. So that's not a good idea. They should copy the good things, not the bad things that male do. The main cause of death by cancer is lung cancer. Is almost fatal when diagnosed, and because it's not easy to identify or diagnose that early. If you see in this slide, this is an X-ray, and then you see around the lungs, you see a white spot, White spot in the X-ray means that there is a mass, that there is meat there, and this is in this case is lung cancer. Smoking cigarettes, cigars, or pipes is responsible for 87% of lung cancer in the United States. So this is the Marlboro cancer, because the Marlboro men were the guys that used to promote this type of behavior, smoking, and then they were the first ones to die. See, they should do a commercial like that, not with a real Marlboro, but a dead Marlboro. Now there is someone who has a problem. He asked for a cigarette and not water. This is because of the addiction. So there is no other product in the world that has the potential of addiction as cigarette smoking have, compared to, in addition to the amount of chemicals that they have that produce disease. So it's very addictive and it's very poisonous. The main type of cancer, lung cancer, is the squamous cell carcinoma. That is 30 to 35%. Then adenocarcinoma is the 30 to 45%. And then 9% is large cells, and small cells is 10 to 15%. Then we have another type of cancer that is related to asbestos, that is called mesothelioma. I would say here, repeating, that the main types are adenocarcinoma and squamous cell carcinoma. Those are the most common. The main mechanism for cancer is irritation, inflammation, or injury of the epithelial cells of the lungs, the cells that are in the external part of the lungs, in the mucosa of the airways. The time of smoking for cancer development is around 35 years. A cancer cell takes at least 10 years to develop. And then survival for lung cancer in 5 years is 10%. You can see that the survival is very low, not because the cancer is that aggressive, but mostly because the cancer was found in a time that was too late. Then also there is an estimate that 16% increased risk for lung cancer exists among non-smoking or people that is married to a smoker. For the workplace exposure, the risk was 17%, and this was promoted by the WHO organization press release number 29. And this was important because after that there is this huge campaign to stop smoking inside of environments. And nowadays, at least in the United States, you cannot smoke in a closed room like that. And you cannot be smoking in any places that there is another people together, except in your house. Unfortunately, many people still smoke inside of their house with other people there that are not smokers and children. I would just say that they are cooperating for their sickness and for their death somehow. Women has 1.5 to 2 times the risk of lung cancer than men. So it's possible that a husband is a smoker and will not die of lung cancer, and the woman that is a non-smoker but live with this guy for more than 30 years will die of lung cancer. That's terrible. Is the leading cause of cancer death? Lung cancer is the leading cause of cancer death. Is 1 in 10 smokers will get lung cancer, and 1.6% of secondhand smoking people that are surrounding the smokers, or what they call passive smokers, will get the disease too. And then there is a relationship with some genetic. So it's not just smoking, but if you are a smoker and by any chance you have the CYP2D6 or the CP450, you are more prone to have lung cancer, because those are the oncogenes. Remember, the ones that activate the carcinogenics in the cells. So they will most likely to die from lung cancer. Some other people, even they are a smoker, they have the GST-M1, that are the enzymes that detoxify the carcinogens, and so they have a protection. That's why not all people that smoke, but just 1 in every 10 will have a lung cancer, because some of these guys have protection, some of these guys have carcinogenics genetic. What is also protective is fruits and vegetables. So antioxidants are protective against the damage to DNA. And then exercise in 21 studies show a protection also. So I always say that people that smoke and do exercise have less health risks than those that do smoke but don't do, do not smoke but do not do exercise. So exercise is very important. Smoking cessation is important across the board for any people in any stage of the cancer or of the life. You always have a benefit if you stop smoking. Smoking, when a person has lung cancer, might affect the effects of chemotherapy. So in any case, it's better not to continue smoking. So what we have in smoking, I will just read this list here, but now we go for a long list of substance that you find in cigarette smoking that might relate to lung cancer, like aluminum, that is from iron and steel founding, arsenic, that is a pollutant that you know for sure that is a poison. Asbestos is the one that call starting again. These are other substances that are not in cigarette smoking, but they also can cause cancer. So aluminum, arsenic, asbestos, chloromethyl methyl ether, bischloromethyl ether, coal tar fumes, erionite, untreated mineral oils, pollutants from iron and steel founding, mustard gas, soot, vinyl chloride, talc containing asbestiform tremolite, nickel chromates, and radon. There are other risks of lung cancer. If a person has had tuberculosis, if a person has had radiation therapy, or if he had or she had previous lung cancer, or a family history of lung cancer. Radon is the leading cause of lung cancer for non-smokers. Radon is a radioactive substance. And then for these, the EPA, the Organ Control of Environmental Contamination, recommend testing for radon and reducing radon in homes that have high levels. So it's important to check your home and check with your city hall to see if you have radon level that is 4 picocuries per liter or higher. So in that case, if you do so, you better move. Or you can somehow take this gas, and sometimes radon is produced in the subsoil. And then if you live in a house that is with concrete, this gas will not enter. But mostly people that live with in a house that has a has the if you live in a house that has a basement or have a contact between the dirt and the part on the floor of your house, then the gas can penetrate on those places for cracks and things like that, and enter inside of the house, and then can contaminate your environment. These are results of state surveys of the concentration of radon according to many states. So I live in California, so California is the pink state, and then no radon contamination. But you have some states like Montana, and then some states in the middle of the United States, and some even in the East Coast that have 20% or greater amount of radon that comes from the soil, and then people have to check. I would advise anybody to check on that. So increase the fresh air makeup to a building can dilute radon and other indoor air contaminants. Increasing air makeup can reduce the negative pressures within a building, thereby decreasing the radon entry. So airing the space will, or having a circulation of air inside of the house also is important to decrease the negative effect of radon. Select a qualified radon mitigation contractor to reduce the radon levels in your home if this is the case. Determine an appropriate radon reduction method. Maintain your radon reduction system. And then keep checking on that, so you might need to have a radon monitor if you find your levels more than 4 picocuries. What's the treatment for lung cancer? Surgery, chemotherapy, radiotherapy, photodynamic therapy with a light activated drug. So all of these surgery is the primordial treatment, and then if there is no metastasis, surgery is the one. But they do other things, because in most of the cases there is already metastasis when they discover the cancer. There is something interesting about causes of cancer. We just mentioned that fruits might protect against lung cancer, and then it might be because of carotene or other antioxidants that they have. But here we know one experiment that was done that carotene was not protective. In fact, carotene increased the risk of lung cancer. And this was done in rats, that they figured out that in some doses carotene is good to protect against the suppression of the gene p53, that is a cancer suppressor gene. And then high doses will promote the suppression of this gene. So if you don't have the p53, you have more risk of cancer. Another thing is that other carotenoids or antioxidants in fruits and vegetables are important for cancer prevention, but not necessarily beta-carotene. Whatever it is the result, we don't advise people to take carotene pills anymore, especially if you are a smoker or live in a place that is very polluted. What's the best source of carotene? Of course, broccoli is it. Broccoli and other vegetables, yellow and dark vegetables. Fruits and vegetables that contain carotene, they are very good choice for that, and they protect against the cancer. And then regular physical activity also protective. Not talking about not smoking, that is the main one. There is some evidence, probably, that foods rich in selenium can protect against the cancer. Again, I mentioned that in other cancers, that selenium is a protective element. Selenium is found in mushrooms, eggs, barley, sunflower seeds, mustard seeds, and oatmeal. And the dose recommended for selenium is 50 micrograms per day. And I mentioned, and I keep mentioning, that Brazil nut has these 50 micrograms of selenium. And then 50 micrograms of selenium, you just take one Brazil nut per day. And here is a picture of Brazil nut, delicious Brazil nut. When you have Brazil nuts, I mean, you better leave the Brazil nut in the fridge because it can be rancid very fast. But if you buy Brazil nuts in the case, I would say, with the skin, the hard skin, you will not get rancid for years. When they are exposed to the oxygen and then they get rancid, they get oxidized. And then rancid Brazil nuts, as well as any other rancid products, are not advisable for eating because they can produce aflatoxin, and I will mention that again when we talk about liver cancer. Liver cancer is related somehow with the presence or the intake, the consumption of rancid foods. In the Adventist Health Studies, in the Adventist Health Study number 1, they have 63 cases of lung cancer. And then fruits daily decrease the risk by 4 times. And then most of these 63 cases were not were smokers or had a past history of smoking. So there is some evidence that foods rich in quercetin are protective against lung cancer. What are those foods? Essentially, red onions is the main in the list. But we found quercetin in apples, garlic, grapes, cherries, spinach, cabbage, dark green leaves, and vegetables. There is also some evidence that eating more red meat and processed meats and eating more fat and butter will increase the risk of lung cancer. I will tell you a story now. Mr. Smith came to my office because he wanted to stop smoking. I helped him to quit, and he was a good patient, and then he succeeded and he stopped smoking for good. A couple of months later, he brought his only son, 20 years old, who was also a smoker, and he brought to my office. And then he was a smoker, and Mr. Smith wanted him to stop, but he didn't have the same idea. "Hey, doc," he said, "I don't drink, I don't gamble, I don't have any other habit. Smoking is the only thing that I do to have fun. So I will not stop smoking for now." Both his father and I tried to convince the guy, but it didn't work. Then I told him, well, when you are ready, you come back and I can help you to stop. Whenever you decide, you can come, and you are young, so it's good to stop when you are young. But let me know. I'm here, you have my address, you have my card, and that's it. It passed 4 years since I hadn't heard from Mr. Smith and his son. And then Mr. Smith came back to my office. And then I asked him again, hey, Mr. Smith, how is your son? Is he ready to quit now? Why don't you bring him to us here? And then we could start a treatment. And Mr. Smith was very sad. And then he said, sorry, but my son died last month of lung cancer. I tried my best, but he never listened. He was a young guy, but with 24 years old, but was killed by smoking. Probably a small cell carcinoma, not the most common type of lung cancer. But small cell carcinoma is much more aggressive than the normal cancer, like adenocarcinomas. Now we have a guy that died because simply he was not ready to stop smoking. So if you need to stop smoking, there are several things that you can do. There are today patches, there are today gums, inhalers, and then medication like Zyban and Chantix that can help a person to stop smoking. You can visit with your doctor and he can prescribe some of these things to you. There are several techniques that are good to stop smoking. And then by the most important, but the most important technique that I like is the spiritual technique. The Bible says, do not be anxious about anything, but in everything by prayer and petition with thanksgiving present your request to God. And the peace of God, which transcends all understanding, will guard your hearts and your minds in Christ Jesus. Another verse says that you can do everything through Him who strengthens you. So if you need to stop smoking, you do your treatment, you do your behavioral techniques, but don't forget the spiritual technique that is very important. This is where we find, this is when we finish this chapter of lung cancer. I'll see you in the next lecture about how to control colon cancer or intestinal cancer. Bye-bye. Até logo. Tchau.